and Dr. Akhil to please felicitate Dr. Mrs. Theresa ma'am. And I request Dr. Theresa sir also to please join her on the stage. Please, a big round of applause. They are the pillars of sexual medicine practice.
सर मैम थोड़ी कलर कोऑर्डिनेट करके आए घर से अच्छा वो तो इवन बेटर टेलीपैथी लाओ हम दे देते हैं अभी चल जाओ अरे अब हो गया बाद में जाओगे
Now I request Dr. Nirupama ma'am, please come on the dais. And I request Dr. Nishi, Dr. Alka ma'am, kindly felicitate Dr. Nirupama ma'am. Poonam ma'am, please join for. Kindly welcome with a big round of applause, please. I request to all delegates, please take your seats. We are going to start our next sessions.
I request all the delegates to kindly come inside the hall. We are about to start our next session. I request now Dr. Nishi and Dr. Seema to please welcome our new chairpersons. Dr. Seema, please welcome the chairpersons of the session.
Good afternoon, everybody. I hope everybody has had a nice lunch. And we promise that the next session is going to keep us up and not put us to sleep. So I would now like to welcome Dr. Poonam Mishra on the dais, please. She doesn't need any more introduction. We've heard her lovely lecture in the afternoon. So she's going to chair the session. Our second chair is Dr. Alka Patnaik. Ma'am, she's a psychosexual therapist and a physician consultant at Suburban Diagnostic India Private Limited. She's proprietor of Patnaik and Associates, CSR consultancy firm, director Patcorp Info Solutions Private Limited. Dr. Alka, please. May I request the chairpersons to please introduce our first speaker of the session?
Welcome you all after lunch. Let us begin the session post-lunch with Dr. Navneet Horror, who's presenting on role of FRP, stem cell therapy, and botulism toxin in sexual dysfunctions. I welcome Dr. Navneet. Dr. Navneet Horror is gold medalist, he has done MBBS, DDVL, dermatology, fellowship in hair transplant, fellowship in dermatosurgery, advanced laser in aesthetics from Singapore, and he's consultant dermatologist and a hair transplant surgeon.
Thank you, ma'am. So first of all, a very good afternoon. This is post-lunch session. So again, as Dr. Akhil said, good morning to all of you. Hope this won't be a boring session. I would like to thank Varun sir for inviting me on such a platform, and again for this such sort of conference, first time in Indian history, which is just focusing on prevention of sexual dysfunctions and rest of the thing, andrology majorly. So this is the first time in India which conference which has been organized and taking care of all the things. So let's start. This is a new topic, I guess, role of PRP, stem cell therapy and botulinum toxin in sexual dysfunctions. So there are various types of sexual dysfunctions, as already discussed by other speakers before me and after me as well, it will be discussed. So the common ones are erectile dysfunction, Peyronie's disease, hypogonadism, hypoactive sexual desire disorder, premature ejaculation, very common again, orgasmic disorders, vulvodynia, genital arousal disorders, especially in females. So sexual dysfunctions, again, I don't want to go into detail as already been discussed. So the common ones are, what is sexual dysfunction? It's from preventing individuals from wanting or enjoying the sexual activity. So emotional factors like depression, anxiety, sexual fears, guilt, which is very common in our population, past sexual history of trauma like rape, any assault or anything, anxiety, which is very common, physical factors, painful intercourse. Additionally, drugs, premenstrual syndrome, pregnancy, again, postpartum period, these all lead to decrease in libido and sexual pleasure. So most common causes are, again, just to sum up, stress, fear and anxiety, alcohol and other drug abuse, mental health, which is again a very common indication, relationship problems, which is very common in today's lifestyle that we are focusing, that we see in our regular OPD as well. The most common things are relationship problems and the lifestyle changes. Medicines, many medicines and treatment, we'll be discussing it in next slide. Medicines are majorly taken care of in the previous lecture. Medical ailments like diabetes, bladder problems, multiple sclerosis, these lead to neurological conditions. So disease factors commonly like diabetes, cardiovascular diseases, CKD, cancers. In cancer as well, like very commonly we have seen it in prostate cancer. After radical prostatectomy, we have seen very commonly the cavernous nerve injury is there. So post that also ED, PME, these are very common things which people face, the patients face. So lifestyle disorders, the most common thing, obesity, smoking, alcohol, stressful sedentary lifestyle, no exercise, nothing, which again leads to add on to these factors. Environmental factors, we can't control them. Drugs, antidepressants, cardiovascular drugs, antibacterial, anticholinergic. So I'll brief about stem cell therapy and toxin, then we'll go to PRP therapy. So stem cell therapy is nothing which is harvesting mesenchymal stem cells or stromal vascular fraction into penile cavernosa. It repairs, heals, regenerates cavernosal nerves. Stem cell can differentiate into anything. Neuronal cells, smooth muscle cells, endothelial cells, which helps in regeneration, new tissue modulation, remodeling, improve sexual function. Very less are the cases that had been identified. But again, this is a topic. Lab in US, Ella Labs, they are doing this very frequently with wonderful results. In India, I guess very less are the people who are doing this. Toxin again, I don't want to go into depth of ejaculation. So majorly, toxin will prevent only in reduction of expulsion phase of ejaculation. Expulsion phase is because of pelvic floor muscles, bulbospongiosus and ischiocavernosus. So we are just going to relax this muscle so that it's preventing the expulsion phase of ejaculation. So the dose is 0.5 to 1 unit on both the sides. So again, this is very less are the cases. Even I have done only 2-3 cases. So again, but this is common topic. Nowadays, many people have started doing this, especially some of the neurologists have started doing this. So now, the most important thing that have came up in sexual disorders is PRP. P short. Very commonly used nowadays by various sexologists, be it dermatologists, psychiatrists, general physicians, or general surgeons, obstetricians. So PRP is when injected into penile or vaginal tissues. PRP can provide a number of compelling benefits. It The regenerative elements contain PDGF, VEGF, insulin growth factors, fibroblast growth factors, and various other things which help in tissue remodeling, tissue regeneration, healing, helps in better vascularity, better blood flow to the cavernosa. For men, this is called as pre-shot or priapism shot is a common name, which can help to improve many symptoms of sexual dysfunction like ED, weaker erections, Peyronie's disease. Again, less proven in Peyronie's disease, but though it helps a lot. Inability to achieve orgasm, unsatisfactory penile length or girth. Though, as we have already discussed, that 2 to 3 centimeter with normal girth is definitely substantial for any sexual pleasure. Women's also can be benefited from PRP. The O shot, I guess Dr. Poonam is a better person to suggest how they are administering. So around the labia, 1 centimeter around the labia, we are injecting this subdermally. So it helps a lot, especially in vaginal dryness, limited sexual sensation, inability to achieve orgasm, weaker orgasm, painful intercourse, laxity, incontinence, etc. So P shot for males, we are going to discuss in detail. So it's a drug-free and surgery-free ED treatment. So drug-free can't be completely drug-free because we have already discussed that drugs, medicinal treatment we have to start with after completely diagnosing the condition. Various modern tools which have been discussed by Dr. Varun, which will help us in diagnosing the condition, where there is a vascular compromise or any other thing. So technique, it incorporates the harvesting patient's own plasma. I'll demonstrate the technique once in the video. The centrifuge separates stem cells, RBC, WBC growth factors, and we are going to inject only the platelet-rich plasma. The concentration of platelet is 4 to 7 times of normal platelets. It uses the healing power of growth factors, PDGF, IGF, various inflammatory mediators, cytokines, etc. Enhance the sexual performance and function. I'll play this video. So it's 8 tubes are taken, mixed with anticoagulant. Each tube is 7 ml blood. First spin is at 2100 RPM for 8 minutes. We separate the supernatant. Again, separation of plasma to take out platelet-rich plasma for second spin. So, for second spin, we got 4 platelet-rich plasma containing tubes. Second spin at 3800 RPM for 8 minutes. So as we can see, we have got the platelets. Almost 8 ml we have got the platelet-rich plasma. Complete 8 ml has to be injected in penile cavernosa. Nowadays, new tubes have come. This is an old video. Nowadays, new tubes have come up in which we need to inject only 4 ml, 4 to 5 ml into the cavernosa. So again, these are the steps. So what are the advantages? Longer, firmer, and more sustainable erections, healthier sex life, easier to achieve and maintain erections, sexual stamina, increased sensitivity and pleasure, improve intimate relationships and self-confidence, improvement in penile curvature, Peyronie's disease. Again, this is not very well documented, but people are getting good results. Improve girth and length in some patients. Again, just 1 day OPD visit and painless procedure. What are the most common indications for P-shot? Because many people are coming to our OPD, they don't want to go for medication because Viagra and all. Very commonly, we are doing PDE5 inhibitors and rest of many medications nowadays. Even the combinations that have started to inculcate in our practice. So, decreased sensation and pleasure. Those men who are getting this, they can go for P-shot without any medicinal therapy or some of the medicinal therapy after proper diagnosis. So medical conditions, obesity, diabetes, BP, cholesterol, medicines, side effects like Viagra and all. Difficulty in maintaining your erection until your partner is satisfied. Very common concern we all see. Decrease in size, majorly a psychological concern. Peyronie's disease. So results of PRP or P-shot, priapism shot starts from 4th week. can take up to 3 to 4 months to achieve maximum benefit. Results may vary. Best results are when we are giving 3 to 4 shots. Nowadays, according to the new guidelines, it's 6 P shots at an interval of 6 weeks each. In females also, it helps. Sexual wellness, clitoral sensitivity, stamina, urinary incontinence, lubrication, etc. Helps a lot. Other modalities, as already been discussed by Dr. Poonam, genital threads, genital fillers, energy-based devices we have already seen, and extracorporeal shock wave therapy. So again, which was already discussed by the by the speakers, that counseling and diagnosis is the most important step, especially the couple counseling, because as Dr. Poonam said, many people are coming to our OPD and they are shocked when we ask that how is your sexual life. So the most important thing is counseling. If we know about their sexual life, they are very well comfortable discussing it with us, because nobody else has discussed about their sexual life with them. Especially in females, this is a problem due to the old religious constraints. So the most important thing remains the counseling, then diagnosis, in which the tools, blood investigation, everything is there. Then we can go on to the treatment. So PRP and these therapies can add on to the medicinal treatment and giving good results. Thank you. Thank you.
Very nice deliberation, Dr.
Thank you, ma'am.
Navneet, because PRP, we have given the name elixir of life. You know, it is autologous, it is from your own blood, and it can be utilized from head to toe anywhere. So P shot is something from you people, and I just adore this.
Similar like O shot from you.
Yeah, exactly.
That was a wonderful talk, Dr. Navneet. I now request Dr. Akhil to kindly felicitate Dr. Navneet. Dr. Nishi and Dr. Navneet, please felicitate Dr. Navneet. Also, I would like to request Dr.